while vaccines are obviously available, we're going to hit the 1 year mark on administration of vaccines in this country tomorrow. So while they're available, the rate of people being unvaccinated and ending up in the hospital, talk to me about what you're seeing right now.
You know, it's really quite disheartening, particularly as a healthcare provider, particularly as a pediatrician, pediatric emergency medicine physician, to know that we have a life-saving technique available to us, a tool in our toolbox, and that people aren't taking full advantage of that is really quite disappointing. We don't have nearly the number of people vaccinated that we are hoping for, and that's across the board throughout the United States. Connecticut, by and large, has done very well, but we're still not at a point where we can feel comfortable at all. And it's really starting to overwhelm our hospitals in Connecticut as well as across the United States.
And what is it like as a healthcare professional for you and your colleagues now to be back into another surge again when, we all, I think, had so much hope over the summer that we were coming out on the other side of this?
You know, I think that's a critically important question, and we've been thinking a lot about that. It's really top of mind. I don't think any of us are fully surprised knowing that COVID-19, that this particular virus is an RNA virus and has the capacity to morph, to mutate over time, which makes it difficult to sort of anticipate and control and to track and to treat. But we do have the vaccine, which is incredibly effective and helpful. I think we thought there would be an uptick, particularly in the colder weather, when respiratory viruses tend to spread more readily, they're more transmissible. You may think of other mRNA viruses, things like influenza. We tend to see that during the colder months, the winter months, and there are a few different reasons for that. People tend to cohort, they're inside, windows are closed, it's chilly, there's a little bit of crowding. People aren't out and about outside where you've got fresh air. So that's one thing. And then in particular, being in November, December, the winter months where we have our holidays that so many people are so looking forward to, particularly after what we went through this last year and a half. People really want to be with their families. Folks are traveling from unvaccinated areas. They're coming to Connecticut. People are spending some time together. There's an uptick. And what's that doing? It's causing the increases that you just reported on. So we're seeing that here in our state of Connecticut, a state that's done an amazing job vaccinating, a state that's done an amazing job testing and trying to control this virus. Our hospitals are getting hit very, very hard. And our staff, our nurses, our techs, our respiratory therapists, our physicians, our frontline people, even folks like our dentists, you don't think of them as frontline, but they are getting hit very, very hard. And I'd be lying if I said that people were not tired. Folks are tired and they're frustrated and they're giving it everything they have to keep our community safe. But it's difficult, particularly since we don't have the same number of staff that we had pre-pandemic. Many people were hit so very hard and so stressed and so challenged that many have opted to take early retirement or have even switched their careers completely, leaving healthcare. So we have a mighty team that's still here working incredibly hard and doing extra shifts, staying overtime, trying to keep our community safe.
Do you think enough is happening to vaccinate the unvaccinated to change the way we're either having these conversations or how the information is disseminated? Because, if people haven't gotten the vaccine up until this point, how would you be able to even change their mind?
A lot is going on to promote the COVID vaccine, but it's almost like an uphill battle in that it's so frustrating to know the misinformation that's out there, the sensationalism about the vaccine, that's misinformation, not based in science, that's being reported on the news in certain papers, not reputable, like Channel 12 and certain venues, but misinformation that can spread like wildfire. And we in healthcare, and you, as a newscaster, have spent so much time trying to dispel those myths, and we're so grateful for that. But to get people to understand the vaccines are safe is paramount, is primary in our quest. We, as part of Greenwich Hospital, as part of an academic health system, Yale New Haven Health, we are out in the community, getting out into the schools, getting out into the community, getting out where people don't have access to healthcare quite readily, making sure that folks are understanding the vaccines are safe, they're available. We've set up mobile units, we've set up clinics. Here at Greenwich Hospital, we had 3 clinic sessions this past weekend, vaccinating 400 children over the weekend from all over the state coming in. I think it's important for folks to know the vaccine is free. It's available to all. We have plenty of vaccine. There's no shortage of it, and that's amazing. It's available to everyone, and we want to give it to anyone and everyone above 5 years of age. All those who are eligible, we want to get it out there.